Good evening and welcome to another interesting edition of our Instagram live session brought to you by the Limi Group of Hospitals. Today, I and my chief will be discussing on safe sex, understanding STIs and their prevention. I am Dr. Ali Vivian, a medical officer, and with me is my chief.
Chinenye, consultant family physician.
You're all welcome. So we're going to be talking about STIs and ways to prevent them. We'll be basically giving you an overview of what STIs are, the types of STIs, how an individual can contract an STI, the symptoms to look out for, things that when you see, you should visit your physician for management, for treatment, how to prevent them, and then the available treatment options for the various STIs. Uh, so before we go further, we'll just quickly say what STIs are. STIs are infections that are transmissible through sexual contact from person to person. Some of these infections can be transmitted through other means aside sexual contact, like sharing of needles, like genital skin to skin contact. These are the major ways by which individuals can contract an STIs. STIs can affect both male and females, but the consequences are more there for females. And if a woman who is pregnant has an STI, it can cause serious health problems even for the baby. So STIs are common worldwide. It's estimated that a total of 1 million people contract new STIs every day worldwide. That's a shocking number of individuals. And each year, there's an estimated 357 million new infections with one of the four common STIs, the commonest being chlamydia, gonorrhea, syphilis, and trichomoniasis. Majority of these STIs are asymptomatic, meaning that people that have them might have no symptoms at all, or they might have mild symptoms, but in others, they can have severe health consequences, especially for women, like we said, things like infertility and things like transmission of the infection from mother to child. So, Chief, in Nigeria, what's the most common STI that we see in clinic or generally?
In Nigeria, you commonly see gonorrhea is
Okay.
the commonest STI in
Okay.
Nigeria.
All right. So, about women, they come to the hospital a lot with vaginal discharge, with itching and all. What is the commonest STI that causes this in females?
It's a bacterial infection, usually bacterial vaginosis, is the leading cause in Nigeria.
Okay, so we've had it bacterial vaginosis, the commonest cause of vaginal discharge in women in Nigeria. We also talked about the fact that there are different types of STIs. We talked about the bacterial causes, and the commonest in Nigeria is gonorrhea, just like my chief just pointed out. There are other bacterial STIs like syphilis, like chancroid, like lymphogranuloma venereum. Don't concern yourself with the big names. Just take it out from this presentation today that the commonest is gonorrhea in Nigeria. Then there are other causes like the viral causes. The commonest ones in our environment is the hepatitis B virus. Then we have the herpes simplex virus 1 and 2. We have HIV and AIDS. We also have the genital warts, which is caused by the human papilloma virus. This virus is also responsible for cervical cancer in women. Then we also have the causes by parasites, protozoa. We have trichomoniasis. We have scabies, which you can get through direct skin to skin contact. And then there's also the pubic lice. So there are various modes of transmission for these STIs. Chief, can we talk about them, the modes of the transmission?
Okay, the modes of transmission is through sexual intercourse, that's vagina intercourse or anal. You can also get it through oral sex. So for those that practice oral sex or those that use sex toys without properly disinfecting it before using it. Maybe you're sharing it with your partner. It's not advisable. So you can actually get it through sex toys and oral sex.
Okay, so apart from the oral sex, anal sex, or this genital intercourse, of course, are there other means
Yes,
that we can get it?
you can get it through IV drug users. If you're all those that abuse drugs, you share needles, contacts with sharp objects that has been used for by another person or someone that has the infection. You can actually be infected through that.
Okay.
So we try not to share needles, razor blades, any sharp objects, because you can get it through them too.
Okay. So can for people who have blood transfusion in hospitals, for example, can they also come down with this kind of infections?
Yes, they can come down with hepatitis B, hepatitis C. They can also come down with HIV virus through blood transfusion
Okay.
or any body fluid.
Okay. So there we have it. So far, we've talked about what STIs are, the symptoms that you find in males and females, and we've told you that the consequences are more dire for women than men and can also be transmitted to an unborn fetus or an unborn child. And we've told you the modes of transmission. It's not only through sexual intercourse. My chief just pointed out all the other modes of transmission. I hope you're following us up on till this point. So we're going to also talk, well, more extensively about the symptoms. We said gonorrhea is the commonest sexually transmitted infection in Nigeria. And of course, it can affect both males and females. So for the females, they can come with complaints of vaginal discharge, which is sometimes purulent or smells really bad. They can have pain when they urinate. They can have painful sexual intercourse, menstrual irregularities, bleeding when it's not time for their periods, or irregularities in the flow or the duration. They can also have lower abdominal pains. So if as a female you're having unprotected intercourse, for example, or you have multiple sexual partners, and then you experience any of these symptoms, it is important that you find your way to your doctor so that they can get a good history, examine you properly, and see what you've been infected with and look for possible ways to manage the infection. For males, they can also have penile discharge. Most times it's described as a milky discharge from the penis, and they also have painful urination. So these are all possibilities of symptoms that males and females can have when they're infected with gonorrhea. So the other thing we talked about is syphilis, is also a bacterial STI. Chief, what are some of the symptoms that people with syphilis can have?
Okay, there are different symptoms depending on the stage you're in. You can have the genital ulcers, you can have skin rashes, then you can have the neurosyphilis. If it has progressed and maybe entered the brain and all that, then you have symptoms of you have the neurosyphilis.
Okay.
So, and if it's like the chancred she mentioned, that one comes with ulcer. The difference between that one and the syphilitic ulcer is that that one is it's actually painful. You have an ulcer that is painful, unlike
Okay.
the other one, the syphilis and the genital herpes ulcer. They are painless.
Okay. So we're saying that people infected with STIs can have either painful or painless ulcers. Okay. So
And sorry, by ulcers we mean wound. You have a wound. You can have a wound in your genitalia. You can have it in the mouth. You can have it, in your skin.
okay. So that means STIs, the symptoms are not only limited to the genital area. People
Yes.
can also have it on the skin, in their mouth, and can also affect the eyes in some cases. All right, so we'll move to the viral ones. One of the commonest we have is the hepatitis B infection. There's also the hepatitis C infection. Some of the symptoms can be acute or chronic. Acute meaning in the first few days, when the person is infected with the virus. They can have things like fatigue, they can have a poor appetite, they can have nausea, they can have vomiting, abdominal pain, they can have yellowness of the eyes, and so forth. Some people might even mistake it for malaria because some of the symptoms are non-specific. They are kind of the things that people also experience when they have malaria. So if you've indulged in unprotected sexual intercourse and you're having malaria-like symptoms, it's also prudent to think about an STI. So for the chronic infection with the hepatitis B, it can cause damage to the liver called liver cirrhosis. And because the liver is damaged, there can be pooling of fluid in the tummy, in the legs, all parts of the body. Patients appear swollen and all that because of retention of fluid in these body parts. There can be bleeding, and it can also cause, in long terms, it can cause liver cancer. Then there's also HIV/AIDS. HIV, we already, I'm sure a lot of us know what it means. The severe or the complication is the AIDS. And basically, there are symptoms of immunosuppression. So the patient can have symptoms like weight loss in the early periods, fever, loose stools, can have swollen lymph nodes. They'll be swelling around the neck, maybe around the axilla, that's the armpits, different parts. You can notice those kind of swellings. There can be a skin rash, also vomiting, nausea, a sore throat, night sweats, things like that. So these are all things to look out for. If you're experiencing any of these symptoms, visit your doctor. Of course, you can also visit us at the Limit Group of Hospitals. We're here to look out for you and take care of you. Chief, the HPV virus. Lately, a lot of people are getting more aware of it. Even in clinics, I hear a lot of people coming to say, I heard about the HPV vaccine, so I came to take it. What really is the HPV virus? What does it do?
And the HPV virus is the human papilloma virus that protects you against cervical cancer. It has a vaccine that females, if you have a girl child that is between the age of 9 to 15 years, you should try to give her the vaccine to protect her against cervical cancer in future. If you also, if you're above that age but you are not sexually active, you can also benefit from the vaccine. And if you're already sexually active and you're an adult, you should be able to do pap smear every 3 years for you to know and prevent against early detection of cervical cancer, and you can be taken care of at the early stage.
Okay, thank you very much, Chief. So, for people who come down with STIs, there are different investigations that can be done to help diagnose which particular infection the person has. And there are various things that the doctor can request for. There's something called culture, meaning that if there's, for example, I told you in gonorrhea, there's a discharge, penile discharge in male and vaginal discharge in females. So the doctor can request for a swab culture of those discharges. They will take the discharge from the penile, from the penis, and from the vagina. Culture is in the lab. See what organism is causing the infection and what exact antibiotic it will be sensitive to. Meaning that the patient can achieve a total cure if it's a bacterial infection. There's also blood tests that they take for hepatitis B, hepatitis C. Then even for other STIs, there's a test called the VDRL, which can also be done. Then to check for complications, like we said, hepatitis B and C can affect the liver. We can do an abdominal scan to check the liver size, check if the liver is nodular or things like that, just to give an idea of the stage of the disease. Of course, if you are seeing things like a liver damage, liver cirrhosis, it means that that is already a complicated stage of the disease. Therefore, management will differ from a stage which is not complicated. They can also do a test called the liver function test to make sure that the liver is functioning properly. So we'll go down to the treatment for STIs. Remember, we talked about the different causes. We said it can be bacterial, viral, parasitic. So Chief will tell us about the treatment modalities for various STIs. Chief.
Okay, for the treatment, it's basically it's individualized depending on which of them from the result of the lab investigation, we'll now know which of them that you have, and we'll now tailor the treatment towards that. If it's the bacterial one, we'll treat accordingly. If it's viral, we'll be giving antiviral. But it's also good to know that most of the viral infections, STIs that we have, they are not curable. You just give the medication to bring down the viral load to avoid complications. But the bacterial infections, the bacterial STIs like the gonorrhea, the syphilis, the chlamydia, all those ones can be treated.
Okay, so Chief, if the viral STIs, if it cannot be cured completely, does that mean that people infected with these viral STIs can keep transmitting the infection to others?
No. If you're on the treatment, like if you have hepatitis B, and we do the when they do the hepatitis B surface antigen and it's reactive, then you proceed to you do the viral load. Depending on the value you get in the viral load, you can start the patient on treatment. When you start the patient on treatment, after some months, when you repeat the viral load, it will not be it will read undetectable. That means it's not detected in your blood again. At that stage, you will not be able to transmit it to another person at that
Okay.
stage.
Okay. I hope we're following everything we've been saying so far. If the viral load is undetectable, it means that the risk of transmission to others is very low or unlikely. So that's that for the treatment of STIs. Then, majorly, we'll talk about now the prevention of STIs. Remember at the beginning, we said we're going to talk about safe sex practices. It's very important to know about that because that's one of the major ways to prevent STIs. So, we're going to be talking about the various methods of prevention. And first on the list will be the primary prevention. So this primary prevention prevents you from even coming down with an STI in the first place. Things that you should do to not come down with an STI. And of course, the first among that list will be abstinence. There will be no way you can contract an STI if you are abstinent. So number one will be abstinence. As much as possible, it's a way to prevent coming down with an STI because STIs are sexually transmitted. If you're not having any sexual contact, there will be no STIs. Secondly, we can also talk about health education, especially since the age group for these STIs we talked about is the teenagers and the young adults. So it will be very important and prudent to talk to them about STIs, talk to them about sex, talk to them about safe sex practices, how to use a condom, whether for a male or for a female, what to do, for example, when you are engaged in unprotected sexual intercourse. These are things that discussions that we all have to have, especially as parents for young children. We shouldn't shy away from the discussion of safe sexual practices. So at an early age, girls and boys know exactly how to practice safe sex if they want to engage in sexual intercourse, and they know what to do if they suspect one because they would have been taught about the symptoms, the complications, so that if they notice any of these things, they can quickly visit a doctor to help manage and then prevent long-term complications. I already talked about promotion of condom use, educate them on how to use condoms. There are male and female condoms, so we want to teach them how to use all of those to prevent STIs. Then, Chief, what do they do in the secondary prevention of STIs? How do we help in this modality?
Okay, for secondary prevention, what we now do, you have the disease already, so early detection, then we try to manage, take care of it to prevent complications. There are a lot of complications sometimes, in the male and females, like she mentioned already. The one in females, the complication can also, you can transmit, if you're pregnant, you can transmit it to your child. So the complication will not just be on you, but also on the child you're carrying. Can cause stillbirth. The child will die in your womb. can cause, after giving birth to the child, neonatal death, the child will die. It can cause deformities. It can also call, when you give birth to the child, you see what you call conjunctivitis. You see, the child will have a conjunctivitis. So all this is what you try to prevent. When you detect it, then you start treatment so that you will not come down with the complication. That is what the secondary treatment is all about. Then you also treat, contact tracing. You identify those that you're sexually involved with so that those people also can be treated to avoid reinfection and spread. Because if you're having sexual intercourse with two people and you come down with any of the sexually transmitted infections, then you treat yourself and you didn't inform those other two. They might have other sex partners, people they're having sex with, then they will keep transmitting it. They will give it to the next person. That person will give it to another person. That person will give it to another person. Before you know it, it's kind of like an outbreak. It's difficult to now control. But if you find it, you dictate it, you try to find out, people that you've had sexual contact with, tell them about it so that they can also treat themselves to avoid complication on the long run, which infertility is part of, both in males and females.
All right, thank you very much, Chief. So remember that we said that the at-risk population for these STIs are teenagers, young adults, commercial sex workers, and homosexuals. So it's very important that in this group of people, you educate them. And then just like Chief said, when they come down with these STIs, you do the test, laboratory test, you give the appropriate treatment, and then you counsel them to treat their own partners because their own partners might have other sexual partners, just like Chief said. And Chief, we also talked about the HPV vaccine. That can also be a primary prevention
Prevention, yes, for
for
vaccine.
the warts and also the cervical cancer.
Yes.
Yes, so far I hope you've been with us listening to us and understanding everything we've said. We try to use basic terms to help you understand, Chief.
Yes. So far, we have tried to explain what sexual transmitted infections are. Infections that you can get through sexual intercourse, whether it's oral, vagina, anal. You can contact it through it, even using the sex toys for those who same-sex relationships that share toys. You can also contact it through sharing the same toys. You can also get it through sharing of sharp objects and IV drug users. You can get it through that. Then we told you about different types: the bacteria, the parasitic, and the virus. Most of the virus, like I said, they do not have cure. You just you give the medication and you reduce the viral load. The bacterial ones are actually treatable. When you have the symptoms, vaginal discharge, there is no normal vaginal discharge. When you have the symptoms, vaginal discharge, painful intercourse, you have a ulcer or pain while urinating, you have a pelvic pain and all that, find yourself to just take yourself to hospital. Let the doctor be the one to tell you that it is normal. Then you can be rest assured that it's normal. If it's not, they will use what we call it's a speculum to examine your vagina. Then the doctor will take a swab, then send it to the lab for microscopy and culture. Then there might be a need also to take blood for other investigation, depending on what the doctor is suspecting that may be wrong or causing that may be wrong with you. Then after that, they make the diagnosis, then place you on the treatment. The important thing is when they prescribe the drug, you have to take the drug for the duration of time the doctor has asked you to take it, so that to avoid resistance and reinfection. Then also inform your partner so that the person can also be treated so that the person can be treated to avoid, because if you treat yourself, and you go back to the source, you also reinfect yourself. That you've had STI before and it was treated, it doesn't give you an immunity. That doesn't mean that you cannot have a sexual STI again. You can have, in fact, you can have it within a space of 2 weeks or 1 week. If you go back to that same source, it can come back again. And some people will ask after having sex that you go when you after having sex and you urinate, does it prevent you from having STIs? No, it does not. It can only reduce your risk of having urinary tract infection, which is it's actually advisable after sex. You go and ease yourself, urinate so that if there's any organism around there, it can go out with the urine to avoid the ascending bacterial infection. Then we talked about the prevention, safe sex. Like she said, abstinence, that's the best option. Then whereby it's not possible, barrier method, condom, whether it's the female or the male condom, is the only thing that can protect to some extent against sexually transmitted infections. Oral contraceptive, whether it's the implants, the injection, the IUCD, all those cannot prevent you from getting STI. Only condom can do that to some extent. Then, if you notice, let's say you're having a sexual intercourse and maybe the condom breaks or something like that, you go to the hospital. One, so that you can prevent unwanted pregnancy. Then you can prevent unwanted pregnancy using emergency contraceptive, which will be prescribed by the doctor, and tests can be done for STIs to prevent or rule out any infection, any STIs infection from that particular sexual intercourse. Then for those like the HPV and the hepatitis B, there are vaccines available. You just need to, for hepatitis B, you just need to do the test. If it's negative, then you start the vaccine, 3 doses. Then for the HPV, like we said already, if you have a girl child that is between 9 to 15, you give the child the vaccine for its 2 doses. Then if you're an adult already, you're sexually active, make sure you do your pap smear every 3 years. They are very simple, affordable procedures that you can do to prevent yourself against cervical cancer.
Thank you so very much, Chief. I've learned a lot even presenting with you today. We're open to questions. Please, if you have any questions, you need any clarifications, please drop a message in the chat box and then we'll respond to them. So we'll be waiting for your questions. But before that, Chief, I noticed that in clinic, patients say a lot of things. For example, one of the common things I hear is that I use the toilet, and after that, I started having discharge and itching. So I think I have toilet
That's
infection
what
in
they call
quotes.
it.
What's that all about? Does that really happen? Because a lot of patients have that mentality.
It's Vaga is they're having one of the STIs. So when you take a swab, then you send it to lab. You can make your diagnosis, then you place the person on antibiotics to take
Yes.
care of it.
So there's nothing, it has nothing to do with sitting on a toilet seat. And STI is gotten from sexual contact only or other means that we already talked about. Then the other thing that I wanted to ask, other patients still ask, they said, can we get STIs from kissing? People actually ask that a lot in the clinic.
Well, it depends. Yes, you can and you cannot. If the person you're kissing has STI and is the one that is in the oral cavity, like oral thrush and all that, yes, you can get it through kissing.
Okay. So provided there's a break in the mucous
Yes,
membrane in the
you
mouth,
can.
then it can be
It can be
transmitted
transmitted through that.
to the other person. Okay. So if you are just joining us, we are talking about safe sex practices, STIs, and its prevention. So far, we've talked about, we've explained what an STI is, we've talked about the various modes of transmission, we've explained the risk population, people that are more at risk of coming down with STIs, men having sex with men, or commercial sex workers, teenagers, and young adults. These are people at risk for STIs. We've also talked about the things we can do to prevent them, primary, secondary, and tertiary prevention. I hope you've been listening so far, and I hope you've gotten a lot from all that we've discussed. We're still awaiting your questions. We'll be glad to answer them. So please leave a message for us in the chat box if you have any question, and we'll respond to them right away. We're still waiting on your questions. We'll respond to them as soon as we get them. So, Chief, we talked about the use of condoms in preventing STIs. Are they like 100%? Are there situations where someone uses a condom and can still come down with an STI?
Yes, like I said, if there's a break in the condom, then you can come down with, you can, if there's a break, means the fluid, the semen,
Yeah.
can now seep through it and now have contact with your vagina, then yes, you can. It's not 100%.
Okay. So
There
condoms
is,
don't
there is
really-
no there is no contraceptive, whether the barrier method or the hormonal, that is 100%.
Okay.
Unless you're doing in terms of family planning,
Planning.
you're doing bilateral
Okay.
sugar
Okay.
ligation.
All right. So understood. You can't. It's not 100% certain that you wouldn't get an STI when you use a condom. However, the chances for transmission are
Very
greatly
slim,
reduced
yes.
when you use a condom. So I just got a question. Does washing the private part after sex prevent STIs? Chief.
No, it does not. It does not. It does not prevent